Plumas County Public Health Agency, growing healthy communities.
As you said, I'm with the California Opioid Safety Network, and what we do is support individuals and organizations, but particularly coalitions, working in opioid safety across California. And the real thrust of our work is an accelerator program that we run for 24 coalitions across California. So what we do is provide coaching, technical assistance, and networking opportunities for coalitions doing this work across the state. And a big part of that is building a learning community for coalitions to learn from one another and share experiences. So we have teams working all the way up in Siskiyou County down to Imperial, so it really kind of provides a venue for coalitions to kind of share their lessons learned, their challenges, tools, and resources. So in the spirit of that learning community and then the event that we're here in today, what I want to do with today's session is have this be a conversation for you all to also exchange and share with one another. So please be prepared to talk. If you don't want to talk, I understand, but I'm going to push you a little bit there to share your experience. You can learn from one another. I myself don't work in rural communities. You all do. You're experts there. And so we want to make sure that there's an opportunity for you to hear from one another. So before we get started and talking about some of the key topics around capacity building and collaboration, I want to do a quick introduction around the room just to get a sense of who's here. So if you could say your name, where you're from, what organization you work with, and then just very briefly if you're either part of an opioid safety coalition or some other type of collaboration in your community around this work. So we'll start here with Marilyn.
Hi, I'm Marilyn Powell, and I come from the Hoopa Valley Indian Reservation. I'm a Kamau board member. That's the medical center there, and we have a community coalition that's started because of the opioid and drug problems in our community, and we've been having monthly meetings with the community for about 15 months.
Thank you.
My name is Ainipo Salaya. I'm a Vista from Lake County, and I work with SafeRx, a coalition that combats the opioid epidemic.
I'm Nellie. I'm also with SafeRx. I'm a Vista as well at Lake County. Yep.
I'm Lisa Godenik, and I work in Lyon County in Nevada for Healthy Community Coalition. We're really trying to get our opioid response, I guess, up and going. We've only done a couple naloxone trainings in our community, and so we're really starting at the very bottom, and I'm looking for tools and strategies to make it truly a community approach. So I'm really excited.
My name is Nikki Collins. I'm from Butte County. I work for behavioral health, and I coordinate our drug-free communities coalition, Butte Youth Now. And we also just received a Partnership for Success grant from the Department of Healthcare Services to focus on opioids. So I'm kind of taking on that role for that grant. So that's where we're bringing in our opioid work.
I'm Sandy Henley, also from Butte County, but in the Public Health Department, where I work as an epidemiologist on paper is what I tell people, and mostly end up doing a whole lot of other things and have been involved in opioid work for basically since the inception of my position there. And before having a more formal structure, we had a couple of initiatives that came out of our CHIP process to address safe prescribing. And I'm a really good scribe.
We'll move up here and then go around. Robin?
I'm Robin Lovell. I'm an employment and training worker for Department of Social Services here in Plumas County. And I only just learned about this coalition about 3 weeks ago. I'm really happy that I got to come to this training, and I hope to be a part of the coalition.
I'm Heidi Cummins. I work for Early Head Start, and I'm here to learn strategies and tools to help families with this and being a part of it.
My name is Judith Marin. I have a grant from the University of Southern California's Health Journalism Impact Fund to write about harm reduction in rural California, a series of stories. So, welcome to learn about.
Wanda Nixon, I'm a community health nurse for Mineral County, Nevada. Yeah, I have a sticky note with your name and phone number on my computer. This is crazy. They're doing, our first naloxone training will be next week, and they're doing it. So, yeah, Middle County's been included in the opioid reduction grant, and yeah, so we're baby steps. We're just starting. But it's been a great conference.
I'm Brenda Harris. I'm the Senior Public Health Nurse for Siskiyou County. We do have a coalition. It's called SARA, Siskiyou Against RX. And we also are a distribution site for naloxone at our public health department. And we are currently, just recently, now doing naloxone distribution into the property of people at jail. And we are also doing continuation MAT at our jail.
Thank you.
I'm Christy Smith with University of Nevada, Reno. We do opioid intervention research.
I'm Ashley Dawkins, and I do the same thing that Christy does.
Research is great.
Yeah. I'm Shannon Ernst. I'm with Churchill County Social Services in Fallon, Nevada. We're also the Community Action Agency. We're the FRC there. I also coordinate the Board of Health, and that's where we're trying to implement some strategies around the opioid issues that we're seeing.
My name is Francis Cooney. I work for Glenn County Substance Use Disorder Services, and I'm the chair of our Glenn County Alliance for Prevention Coalition.
I'm Kylie Peterson. I'm from Mendocino County, McCaven in Mendocino County. We're a syringe exchange. I am a behavioral health case manager and benefits advocate. And yeah.
Are you part of the coalition in Mendocino, the Mendocino Coalition?
Yes.
Okay. Quick intro, your name, which organization you're with, and if you're part of a coalition or collaboration.
Yes.
Oh, yeah. My name is Chris Knox, and I am a substance abuse counselor, and I work for Rethink Industries, and this is my boss. Without further ado.
Okay, boss.
I'm Allie Kenny, and I'm the owner of Rethink Industries. We are a private practice, and we've been really involved in the coalition. We have a Prop 47 grant, and so we work directly with alternative sentencing and working to reduce recidivism, as well as I hold contracts with public health and our hospital here through the hub and spoke that you've heard a lot being talked about. And so doing a lot of the bridge work, trying to connect with more permanent counselors, as well as doing counseling and substance abuse work and just a lot of things. Yeah.
My name is Lindsay Morrison. I'm a nurse case manager. I work at the hospital here in town. We're a part of the coalition. I work on safer opiate prescribing, worked on setting up a MAP program. We set up the contract with the Hub and Spoke through Aegis, and work with the county frequently, and with Allie for behavioral health.
Perfect, thank you. I think we've got everyone. Actually, no, Andy, could you introduce yourself, please?
Yeah, my name is Andy. I'm with SafeRx, and I'm in Wake County.
Great, fantastic. So this is perfect because I'm hearing a lot of different sectors represented here from behavioral health. We have some clinicians, journalists working with families, researchers, and this is kind of part of the work, and what we want to talk about with coalitions is really kind of the importance of bringing different sectors and different mindsets together at the table, and we'll talk through some kind of tools and strategies for making that happen, and the fact that you're already, many of you, part of coalitions. The idea here is to kind of help you think of some tools and tips to really kind of improve the infrastructure around your coalition and how you can do that multi-sector work more effectively. So if you go to the next slide, I'm just going to talk a little bit more about the work that we're doing as a network so that you're all kind of aware of who we are and how we might be able to support you. So like I said, we support the capacity of coalitions across California. And our network is based in the Center for Health Leadership and Practice at the Public Health Institute in Oakland, so that's where I'm based. And we started doing this work for the California Opioid Safety Network, really drawing on our experience of working with multi-sector teams across the country on behalf of CDC. We run a flagship National Leadership Academy for the public's health. And the whole idea is working on kind of the science of collaboration. And regardless of the topic for any team, whether they're working on environmental health and built environment, obesity, kind of any topic area related to public health, what we do is provide kind of the coaching and support to help them do their work effectively. So that certainly kind of translates to what we're doing around opioid safety and what brought us to this. And we are funded by the California Healthcare Foundation. Early on, Dr. Kelly Pfeiffer, who you saw in the video that James showed yesterday morning, has been a huge leader in California around this work and saw the work of local coalitions and really understood that culture is local and we really need to do systems change at the local level in order to save lives and the real importance that local community coalitions can play in addressing this crisis. And then we have an exciting partnership with the AmeriCorps VISTA program. So we have these, 3 fine folks here from the Lake County Coalition who are VISTAs. As the network, we are the sponsoring organization for up to 40 VISTA members to support local coalitions across California. So that's been super, super exciting because coalition work is hard, it's time consuming, and so having some extra support to build capacity through the service of an AmeriCorps VISTA has been a huge asset to many coalitions. So that's a really exciting part of our partnership. And then we also work closely with the California Department of Public Health that provides some grant support to several coalitions. And one more click. So again, we do this work all across the state. The real thrust is this accelerator program that we run for 24 coalitions that have applied to be part of our program. We know Sandy's coalition, Butte Glen, Lake County is one of our 24 coalitions, and we work intensively with that group around capacity building for their work. If you're interested in being part of the network as a whole, that's easy to do. You can go to our website, which is CaliforniaOpioidSafetyNetwork.org. There's a place to sign up for our monthly newsletter. And what we do is we send out information on what's happening around opioid safety in California. Like this event, for example, what's happening around the naloxone standing order, upcoming webinars, highlights of coalition work and local activities happening in particular communities. So you can get on that newsletter. Also, if you see on our website, there is an interactive map on the page for About the Network. And if you click on that map, you can find the websites and information for all the opioid safety coalitions that we work with. We're constantly hearing about more, and we don't know about all of them. So if your coalition, the California one, sorry for the folks in Nevada, but for the California coalitions, if you're not on the map, please let us know, and we'll get you up there and make sure that you're visible as part of this network. So we started doing this work following an assessment that we did on behalf of the California Healthcare Foundation, looking at an original cohort of about 16 opioid safety coalitions. So Dr. Pfeiffer had, like I said, really kind of seen the value of local coalition work and wanted to take a pause and reflect and see, like, are these coalitions making a difference? And they are. We did an analysis that actually demonstrated that counties with coalitions supported through the network had significantly reduced prescribing and increased buprenorphine prescribing compared to other counties that did not have coalitions. So we cannot make a kind of direct causal link, but we are seeing a huge difference in terms of the outcomes for those kind of communities that do have coalitions. And then also, as part of this assessment, we wanted to unpack what makes a healthy coalition. And you all, many of you, are part of and doing this work. So not all of this will be surprising to you, but it's really important to recognize that collaboration and systems change at the local level is more than having the technical expertise around opioid safety, but it's also making sure that when you're collaborating, you have this broad engagement of many partners, you have a very clear vision and focus, which we'll talk about, and that you have effective leadership and management. So that's how we designed our program and supporting coalitions, is around these main principles. And the coalitions that we're working with really are focusing a lot on safe prescribing in the early stages, and now have a lot of the thrust of their work is around MAT access, naloxone, harm reduction. If you've seen one coalition, you've seen one coalition. They're not all the same, but those were kind of the core components for all of their work. So the next slide. So again, one of the main kind of principles of our network and our values is that in order to reduce deaths and reduce suffering, we really need to take an all-hands-on-deck approach. And that's this coalition model here that you see here. So if you've seen one coalition, you've seen one coalition. Like I said, some are based in medical societies and are not really true community coalitions. But a lot of the ones that we're working with through our accelerator program are using the support that we're providing to take a pause and think about how they might expand their partnerships and become more of this multi-sector approach. So part of that is stopping and reflecting on kind of where you fall in terms of this kind of spectrum of working together. And there's lots of different ways to work together in various stages. And so you might want to think about where you fall in terms of how you're partnering with organizations in your community, if it's kind of true collaboration or more kind of on the cooperation. So what do I mean by that? Cooperation is something that's more informal. So it can be something short-term, one project that you might be partnering with another organization to work on, but there's no real organizational structure or formality to it. It gets more complex and intense as you work towards coordination. Maybe you have one program in play that you're working on, have some more formal agreements, but it's not this kind of sustainable, kind of organic model. And then there's the kind of true collaboration, and that's where a real coalition fits in. So again, encourage you all, just as we've done with our coalitions that we're supporting, to kind of think about where you fall in that spectrum and what you're working towards. Is it really kind of towards this infrastructure of kind of complex and intense collaboration, and is that with specific partners, or is it more some of these more kind of light collaboration models, and where you kind of fall within that spectrum? So why do challenges arise when it comes to collaboration? A premise that we have is that coalition work and collaboration is messy. It's messy by design. That's something to accept and acknowledge. And what we'll be talking about are some of the tools and pieces that you can put in place to try and address that messiness in your work. And then when it comes to the opioid epidemic specifically, there are some nuances to it in that it's very fast moving, it's intense, there's a lot of emotions in play, both personal and interpersonal and institutional. And so you take kind of the messiness of coalition work and then you add the intensity of this specific epidemic on top of it, and it really suggests the need for you to be very kind of planned and structured and thoughtful in how you collaborate around this issue. So some of the most common challenges that we've seen with the coalitions that we're working with is around passionate members. So again, this is an intense topic. You need passion to do this work. It's not a bad thing to have passionate members in your collaborations. It just is. It's not bad, it's not good, it's just what it is, but it's something that can sometimes bring up and lift some challenges. Burnout. We hear about this a lot with coalitions. Most folks that are part of coalitions are doing this on top of their day job, on top of 2 day jobs, in fact. And so kind of thinking about ways to address and mitigate burnout is really important. External issues, that can be staffing, funding, policies, other things that are kind of affecting the organization and the work that you're doing. Conflicting agendas on how to address this epidemic. So we've heard a lot around the harm reduction approach at this conference and how important that is. A lot of coalitions and collaborations traditionally have focused more on kind of the medical model and safe prescribing, so sometimes there can be kind of conflicting visions and approaches for doing this work. There can be control challenges around identity, ideology, strategy. These can be overt or non-overt, but really kind of who's leading this work. And then recognition and resources. So money and funding, that can always cause a lot of tension and kind of turf issues in collaborations, but it's also around branding, logos, recognition. when you're bringing lots of people to the table, it's important to kind of think up front about where those challenges come from and how you might resolve them, and how that impacts the dynamics of your coalition. So we're going to go into some tools and tips on how to address these challenges. But what I want to do first is almost like a mini therapy session. It's kind of good to get it out there. So I'd like a couple folks just to look at this list and tell us about what you see as the kind of the biggest challenge that you've had, maybe from this list or otherwise, in terms of the collaboration that you're doing within your community. Which of these resonate the most? Go ahead.
Conflicting agendas.
Okay, what's an example of that?
Down there in ideology, like what's the purpose of this coalition? Well, there's many members that think it's all about prescribing practices. And initially when ours began 3+ years ago, our harm reduction organization wasn't even invited to the table. So I had to kind of, invite myself. And when there were things that our agency had been addressing that were discussed, we were actually cut off because it was very, very driven by people who had not had any experience in that area. And even naloxone prescribing was being discussed without anyone questioning us, and we've been dispensing it in the community for 10 years.
Right.
And there wasn't any interest until they needed us to be a distribution site. So it was just, and there's still a little bit of it, although I'm going to say some of these things have been worked out a little bit, but I still think there's really too many agendas at the table.
Okay, well, we'll talk about some tools and tips around that, and be curious to see, as we get to those, what strategies you all have used. What else?
Previous bad relationships.
Okay.
I've seen that a lot in Lake County. Not necessarily bad relationships, but like non-existent relationships. Like we're trying to create relationships with different partners, like law enforcement and the medical community, and we're trying to call them and trying to tell them who we are. Like we're trying to set a presence. Like we said, we have 4 vistas, so we're trying to hit the ground running. But it's a little bit difficult because it is a small town. They're not as Save Our Rights has existed for a while, but they didn't have nearly as big a presence, or they weren't as successful before. So it's like, how do we establish this relationship? So the bad relationships that were created, like we have a needle exchange and they're not really willing to partner with us. It's kind of like, do we create another needle exchange, or do we try and get the one that already exists like on the same page with us? And it's kind of like, we don't want to be contentious, but we don't want to be acquiesce either, so it's kind of like.
And sometimes those bad relationships precede the work that you're doing as an individual, so you're kind of coming into that, but that's going to play for however many years. One more?
I say passionate members is one I run into a lot. I've been guilty of, and also the victim of. And it's something that I've had to just in doing this work, kind of, you kind of go in and assuming everybody has the same agenda or same goals. And sometimes you find that's not the case, and someone's ideology is very far from yours, and learning how to say we both want the same thing, but we just have different ideas about how to achieve that is a lesson I've had to learn on the fly.
Yeah. And anything that's not on this list that we're missing, that you think we should be adding to our list based off of your experience? Okay. So let's go to the next slide. The tools and tips we're going to talk about are around vision and purpose, stakeholder development, turf, trust, and relationships, which just came up a lot, and then process, structure, and communication. So these are all around ways that you can build a strong infrastructure for your coalition. And again, the ones we're working with hit the ground running. A lot of them didn't take the time, which makes sense, to kind of build this infrastructure. So what we're doing and the support that we're providing to them through this program is helping them stop and reflect and decide which aspects of this infrastructure they want to take the time to build right now. We do have some tools that I'll show you some examples of. I have printouts of some of them, not all of them here, so after the session, feel free to grab any. And then if there's something that we talk about, and I don't have a tool for over there, you can let me know and I can always email you something after the session. So let's start with vision and purpose. And this sounds super basic, but that's really important. And it goes to that question of not have that I think Sandy was mentioning, of avoiding assumptions that people are at the table for the same reason. Sometimes we assume we're all there for the same reason, and that's not the case. So it takes time, but it's really, really important to spend that time building a shared purpose and a shared identity. So why are you here at the table? What brought the group together in the first place? What's the history there? And again, I'm hearing at this conference there's a lot of really important talk around harm reduction, the harm reduction community, and also really hearing and listening to the voice of people who use drugs. That might be a huge shift from the way some of the coalitions and collaborations that you're part of kind of got up and running. So making sure you're spending that time and reflecting on your purpose, and particularly as this epidemic evolves. So one tool that we use to do this is called the Big Picture tool. And all of the coalitions we're supporting complete this tool as part of our program. The idea here is on one sheet to be able to express the vision and purpose and goals of your coalition. And this takes time to do, but it's really, really meaningful time because it allows people to kind of sit down, reflect, and decide collectively what impact are you trying to make, and then be able to kind of resolve some of those potentially conflicting agendas. So the way that we have this panned out, and we use this not just for our opioid project, but again for our other program, working with multi-sector teams across the country, working on a whole range of public health topics. But we have teams list out their impact statement in a concise way, talk about the socioeconomic, political, cultural, racial context around the work, like what's kind of feeding into this, the need for this work, the rationale for their work, the priorities, stakeholders, and then outlining what their kind of long-term and short-term outcomes are. And so we've really heard that this is a valuable exercise for folks getting on the same page. It's meant to be an iterative and dynamic tool. So it's not that you do it once and then you're done. You can revisit and go back to this over time, which a lot of our teams are doing. But it's helpful to get folks on the same page, and it's very intentional that it's on one page. Because you can create this huge, long strategic plan. Strategic planning is important, but it's also important to have some kind of parsimony in how you express and define the work that you're doing. The next one, example of how we help teams think about their vision and purpose is for their external communications. So this is a template. We have an example over here of it for creating an elevator pitch for your coalition, so that if you're talking externally to the media or trying to bring on new partners or for your website, having a framework to kind of list out and articulate who you are and what is your coalition all about. That's super important to have that elevator pitch. We also have a template for a fact sheet. And by that what we mean is kind of a way to outline what your coalition is working on so that you have the core components to put on a website or for social media and really kind of think and articulate what that looks like. And for example, one of our coalitions, Marin County, which is lifted up a lot as being an excellent opioid safety coalition, they're actually, they hit the ground running, moving really fast. They're taking the time right now to revisit these types of tools and taking a pause to think about their collective vision and purpose. So discussion. I'd love to hear around some examples of whether you think in your community there is a shared vision and purpose in terms of the work, particularly around your coalition and collaboration work. And if not, why don't you think there is that shared vision and purpose? And you talked a little bit about this already. Some other examples?
Can I just say something really quickly? I'm not writing about anything anybody's saying in this room unless I talk to you first. So I didn't realize people were going to be sharing. So I just wanted to
thank you for that disclaimer. Okay,
yeah,
great,
yeah.
thank you. Yeah.
I think the vision and purpose that, at least in Plumas County, has found itself to be fairly mutual. Definitely with some challenges and lots of prior conversations to get there. But I think the passion into this vision and purpose really has just been so humongous because we have a really long history of difficult relationships amongst all the different agencies and a lot of turnover and a lot of things that have gone on here. And I think this vision and purpose is what's really bringing people together. I mean, I've been absolutely shocked about some of the people I've seen in a room willing to actually have a conversation about some of this. And so I just think that is amazing.
And what process did you go through in terms of establishing that shared vision and purpose?
I wasn't really involved in all that. I was kind of in like,
but we're redoing it right now.
Right. Yeah.
You know, so.
Yeah, and it seems that more and more partners are getting together to create what is, as opposed to like one person kind of dictate. And Zach, you probably have way more information on this, but more people are coming together and figuring out what the mission, vision, purpose is all together, as opposed to somebody just dictating all of it. So.
And what's fundamental to that is the fact that you, for example, came in after some of this work had already started. Yeah. So having that articulated so that as new partners come on board, there's a shared understanding of what that vision purpose is. Does anyone else have an example of kind of their process that they took around this?
I really think this is an amazing process, and the fact that in a lot of our rural communities, we have several collaborations, and each one has a different vision and a goal with it, and I think it outlines it. We're at the table for this purpose. And there might be another one, but it's keeping that separate. It's helped in our community identify what partners we're missing when we go through this process. Because so many times you get focused on the ones that you work with all the time that come to the table for everything, and it really has helped us.
And we're going to get into that a little bit more. That's perfect segue. Did anyone else want to talk about vision and purpose before we move on to the next topic? Okay. So stakeholder development. It's important to be very strategic around who your stakeholders are. I mean, we believe in coalitions bringing everyone to the table, but there's also very kind of thoughtful consideration in terms of who you need to have at the table in order to get the work done. So we talk a lot about power brokers or power holders. Those are the folks in your community or organizations even that hold an element of power and influence and that people listen to. And it doesn't need to be a ton of institutional power. I mean, this could be someone from a parent, this can be a teacher, someone from a police officer who everyone listens to, a faith leader, and someone who's in the drug using community even. But having those influencers as part of your collaboration is really, really critical because that's the voice that people are going to listen to get involved in this work. And then their mindsets. So thinking about what is the perspective and mindset of those power brokers. When you invite them to the table, you want to think about why they want to be at the table, not what brings you to the table, but what's going to be compelling to them for being at the table. And this came up a little bit yesterday in some of the exercises that we did in the big group discussion and thinking about kind of pushback around the harm reduction model, for example. So it's really important to think about, and again, we have some tools to think about some of the infrastructure for doing that. So the next slide, partnership mapping. Who here has written out a partnership map for their collaboration? Okay, so this is something that we recommend for the teams we work with. All these are very simple tools, but they're meaningful exercises in thinking about what is the work that you're doing. So for a lot of our coalitions, they're kind of bucketing around reducing opioid supply, promoting recovery, and preventing death, so around those kind of key strategy areas. We encourage them to do this process of outlining the partners that they're already working with, partners that they've talked about working with, and then which partners they might add if they were trying to focus specifically around one of these topic areas. So again, being really kind of strategic and organized in your thinking around who's on board and who needs to be on board. And actually an example of this from one of our coalitions is the Redwood Community Health Coalition in the Bay Area. They started basically as a consortium of clinics working on safe prescribing. And they've used this tool to do a very intentional process of broadening their membership and thinking about how they need to be more more of a community-oriented coalition and who they need to bring on board. The next tool is a membership roster. So this goes to this concept of thinking about what will bring someone else on board. So listing out the organization, what their self-interests are, either individually or as an organization, and what contributions they might be able to make. So let's go to the next section, which is on turf, trust, and relationships, which I've heard a few examples come up already. So again, coalition and collaboration work is messy by design. We know that's the case, and it's just important to acknowledge these turf issues and to acknowledge some of these organizational tensions. And just starting from that point, and then lifting them up to the surface and having some transparent conversations around that and around the kind of the history and expectations. Sometimes people are asked to join coalitions and be part of groups, and they're sick of doing all the work all the time. They're tired of it, tired of being asked to do everything, right? So having those honest conversations and then creating multiple layers of participation and roles. So it doesn't mean that everyone has to do equal amounts of work. Some people can be part of decision making and not necessarily be assigned to do everything, but thinking very intentionally with your coalition and your collaboration around what those roles and participation and expectations look like. A key point we talk about is discussing the appropriate role of development and funding. Again, when money comes into the mix, that's when a lot of tension can come up. Raise your hand if this has been an experience that you've had. A grant, money comes in, and okay. Any examples around how you resolved that, and or would it have helped to have some systems in place around decision making when it comes to money ahead of time? Yes, you're nodding your head, yes. Okay. So that's what we agree on, go ahead.
As a community-based organization that engages mainly in these partnerships, where the partnership is mainly government organizations, we are encouraged to give over all of our data and all of our juicy information and all of our unique ways of doing things in these coalitions that they get paid to run. And then when it comes time for money, we are ass out. And then looked at like, well, why are you even bringing this up? So a lot of the previous work of like, map this stuff out. Have those honest, that sounds awesome. I don't know if it can happen, but it sounds awesome.
So it's certainly, this happens with all groups and all organizations and collaborations, and it's super, super messy, but having those conversations up front and setting some of those kind of precedents around funding in particular, but all sorts of decisions, which we'll talk a little bit more about, beforehand is super important. And then the trust building. That takes time, and this is fast moving work, but accepting that building those relationships is really, really important. And building that trust and kind of accepting that is going to take some time. So groups rarely spend the time to sit and talk about these kind of historical dynamics. We strongly, strongly encourage it. If you can have those transparent conversations, that can really, really help. And then having the kind of trust building. I mean, that can be as simple as having coffee and going out and meeting and kind of accepting the time it takes to really build that relationships at the beginning of meetings, after meetings, really kind of having those dynamics in place. Examples I'd love to hear around how you've worked to build trust with other partners that maybe were resistant in the beginning. Does anyone have any kind of success stories to share around how they've built that trust and helped with some of these kind of turf tension issues? Yeah.
Sorry.
No.
I think for me, as coming in as a, for-profit private entity, there's a lot of fear that came up when I opened my company here, and the fact that I was getting grants. So I think there was a lot of tension and fear around like, what are you doing? What are you trying to take away from our government and nonprofits around here? And I've done a lot of going to coffee, a lot of, I don't want to steal your clients, I want to work together, and being really open and willing to collaborate, making sure I have release of information for anyone any of my clients are treating, and making sure that I'm making contact with all the providers and just letting them know, like, I'm doing this, and I'm primarily do brain spotting work, which is a trauma modality.
Okay.
And so really just education around what it is that I do and what it is that I'm really trying to add to their treatment, and not trying to step on their toes. So just a lot of conversation of just like, how do we work together?
And has that been effective, and has that been working well?
Helpful, really well received. I mean, I think it's shifted a lot of the work, and I keep getting more work, so I think it's working.
Building those relationships and spending that time has been rewarding. Okay, great. And then what partners are you missing from the table? Who have you tried to engage and really kind of need to be part of this work that you don't have and that you need to have? Tim?
So I'll say for our coalition, I think just engaging our law enforcement, we could do a better job of, because they have, this affects them, and we need to work with them. And we need to be transparent and maybe not agree on everything, but come together on things that we can agree on. Okay. So I think that's who we really need to start courting a little better, and then also probably business.
The business community.
Yeah, business community in our region, because they have a lot they are some top brokers.
Yeah.
Our coalitions work hand in hand, and I would say faith too. We've kind of been not having them at the table, and we always like to have young people, because our coalition was kind of founded on that, and just you have to think about the timing. It's like 3 to 5. Like it's hard for them to get over to the meeting right at 3, but it's hard to get people to the table sometimes.
Yeah. And have you looked for a particular, I'm assuming you have like a messenger or some kind of spokesperson from law enforcement and the business community who can be that champion?
For law enforcement, we have a couple of champions. I think in our Chico PD, we've got a guy who's come to community events, and and now I think my strategy is to kind of try to ask him to maybe go talk to the sheriff and tell him,
for sure.
Because I think they just a peer-to-peer model just works better.
Yeah.
So we're gonna listen to him, make a lot easier than they're gonna listen to me.
Yeah. And has anyone else had success in terms of engaging those partners, in particular, law enforcement, the business community?
We applied for the Glenn County Alliance for Prevention. We applied for the Drug Free Communities grant, so we did a lot of outreach to the 12 sectors, and we seem to have gotten a nice buy-in from law enforcement. We have sheriffs and probation officers and CHP people showing up. We struggle with media. There's kind of like no media in our county, so that's like a sector. Like we went to the Office of Education, who has a newsletter, and like so their newsletter editor is our media person, but it's not really a newspaper or anything like that.
Okay. So it's been hard to make those contacts?
It's hard to create media where there's no media. Like, I don't know, most of the media is kind of like overflow from Butte or Tehama County.
Okay, gotcha. Okay. Does our journalist here have any kind of encouraging recommendations in terms of getting some media attention?
Do you have a local newspaper?
What's that?
Do you have a local newspaper?
We do, but they're centered out of Yuba City. Like they're our paper, but their office is not in our county. It's in a different county.
I'm sorry, which county are you from?
Glenn.
Okay, so you don't have like any kind of like alternative newspaper or anything like reporting on community? Like even this one, that comes from, I think this is Plumas County, I picked this one up. You don't have anything like that?
I don't know so. I mean, we have a local paper, but it's not like their office is in Yuba City. It's owned by another newspaper.
Right, you might be able to get a grant. The McKnight Foundation has some grants for starting up small town media or like
create our own newspaper.
Exactly. Right. Yeah. Even if it's just on the internet. Even if it's just, yeah, even if it's just online, you know, you don't, which is like a really low overhead, you don't need to actually print something up.
And we have some tools, some of them over here from our communications partners on how to get also some media attention in terms of using your social media, writing blogs, letters to the editor, op-eds, those types of pieces as well. That could kind of span outside of your county. Great. So next topic, process and structure. So this really kind of centers in this infrastructure piece that I keep harping on of why it's important to be very intentional around the infrastructure that you have for your coalition. This helps make sure that all members understand how things work within the collaboration and where they fit. A lot of times this can be documented with bylaws or a charter. Does anyone here have a bylaw, like a set of bylaws or charter for the collaboration they're working with? Okay, in the back, anyone else? Okay, so a lot of coalitions don't. Most of the coalitions we're working with don't, but are kind of taking the time now to kind of build those and put those in place. They're somewhat formalized structures, but they can denote some other important elements for hierarchy, like around decision making. So you can decide how formal you want your structures and agreements to be, but it's good to be intentional on what it is. So some kind of basic models around structure for collaboration are the table and the wheel. The table is where everyone's kind of coming together at the same table. Maybe it's a smaller coalition or collaborative and everyone meets together. A wheel is kind of this hub and spoke type concept. Maybe the wheel in the center is your steering committee that makes a lot of the decisions and meets. And around the edges you have these like action teams or work groups that maybe are working on kind of particular topics. So I know for some coalitions there's a central steering committee, and then there's action teams around data and surveillance, around naloxone distribution and particular topics. So who here has a wheel structure, would they say, for the collaboration coalition that they're working with? Anyone? No one? Yes? Lake County does? How are you structured?
We have a steering committee, or that's how it was structured before. They had a steering committee and they had action teams. So we're trying to rejuvenate that right now.
Okay. Yep. And it could be a lot of work. It can be a little more complex to have that structure. Okay. Who here doesn't know what structure that they have? Okay, that's fair. Good. I appreciate your honesty. So again, kind of thinking strategically and intentionally around what your collaboration and coalition looks like. And then that feeds into the next piece, which is having an agreed upon decision-making process. So again, when money comes into the mix, it's good to have this in place to really be intentional and know how decisions are made. And most coalitions don't spend the time to do this. And they kind of go with the flow of how they've been making decisions all along. And then something that's really tense comes up. And there's a lot of conflict. So here are some examples of different ways that decision making can happen. There's unilateral decisions, so sometimes this makes a lot of sense to have one person or one organization that's in charge of making decisions for the group. It can be consultative, so maybe that individual or organization is consulting with others but still is responsible for making decisions. You can have the democratic or majority vote, which works a lot of the time, or consensus building or a unanimous vote. That's really, really hard work. It takes a lot of time. A lot of people really want to reach consensus, and it's important work, it's great work, but it's challenging. And one tool that many of you have probably used is kind of this gradients of agreement. If not, you can look that up, but it's a model where people can kind of use their fingers to designate the gradient of which they're in agreement, so that you can kind of go back to the table and work towards consensus, and maybe kind of flex and adapt your decision to get to consensus. And then there's delegation. So maybe for one particular type of decision, you need to delegate one group or one person to make that decision, depending on what needs to be in place. So again, a simple tool that we have, I think we have some examples over here, is a decision-making protocol. So outlining for your group what decisions, or the type of decision that would need to be made, whether it's around funding or priorities, or having kind of protocols in place. With what level of authority that decision will be made. So is it the unilateral, consultative, consensual decision? Who will be making those decisions and where they fit in that structure? So again, an intentional way to kind of set this up front. Can a couple folks kind of share how decisions are made within the collaborations that they're a part of? I see you smiling. Can you share a little bit about that?
I go to a room and a bunch of directors and things say, this is what we're doing.
Okay.
And I'm like, but don't forget, that might kill people. And they're like, shut up, harm reduction. That's how it's paid.
And was there ever a conversation up front that they would be the decision makers? Was there kind of a conversation?
That's just the overarching, because they are very knowledgeable and very informed doctors and directors of doctors. It's just sort of a known, that's how
That's where it falls and that's the, okay. Yeah, right. Go ahead.
Ours is probably pretty well driven from public health. And they were the original conveners, and a lot of the decisions and applications for funding and such just sort of revert to them, and there hasn't been a lot of challenge in that area. A challenge against that.
That norm and expectation.
Yeah, that norm.
Okay. And would it be possible or make sense for certain types of decisions to not always fall with
Yes.
public health?
But we have a very long history in our county of a lot of things being driven through public health, if not by public health. And things are changing somewhat, but it's kind of a very old paradigm, and it's just sort of, everybody just follows the lead and shows up, and it's difficult to sort of break that habit.
Yeah.
But again, there's new people there, and so things are changing somewhat.
Yeah.
But it happens all the time, and even our COC, for the homeless services, it's driven by Health and Human Services, and then they convene. And nobody else wants to take it on, which is another, because there's a lot of smaller, much smaller nonprofit organizations who can't. So by default, it happens a lot, but then decision-making by default happens a lot at the county level, Health and Human Services level. Much harder to get input.
Do you think they'd be amenable to having some sort of more intentional conversation around decision making?
I think some of the folks
Some
at
would?
the table would, yeah.
Who else?
We have an admin meeting for the coalition about 10 days prior to having the meeting itself. And so, like the chair and the recording secretary, and then the people that use the coalition for their grants, like the public health tobacco, and Friday Night Live is there. So, and then so we set the agenda and usually find like somebody to speak at the coalition meeting, from that point, like who's going to present. And then when we have something that we want to vote on, we like electing people, or do we want to do this training, or we vote at the.
So you go for kind of a democratic majority rule?
Right.
Okay.
Yeah. So it is a majority rule where we vote at the coalition itself, but we do also have an admin meeting that sets the agenda and.
Okay. And have there been conflicts in play when there's majority rule, but then for those folks who disagreed with the decision, how has that played out?
It hasn't happened yet. It's usually they're in consensus with what, like everybody, yeah, let's do that. So.
Anyone else want to share on kind of decision-making processes, what's worked, what hasn't worked? Yeah.
What I've noticed with our public health seems to be really in control of most of it, but they do a fabulous, fabulous job at including community members. We've had lots of planning meetings for the community as well as monthly meetings. So we've done a lot of taking everyone sort of, not vote, but looking at really what their ideas are, writing them all down.
Incorporating their
and then
input, yeah.
Public health, I don't know what happens behind the scenes there, but my guess is they compile all of that, and then at the next meeting they sort of present what ideas were, communicated the most and that kind of thing, and I just feel like they do a really great job at incorporating the public.
So it's reflected in that decision. Great, great. Okay. So the last piece is around communications. So again, setting up internal communication systems for how you talk internally within your coalition is super, super important to make sure that everyone has the information that they need. And establishing up front what type of information. So I was hearing from, was that Glenn County that you were saying, that you have kind of agenda set, right? And is there a formalized structure in terms of how the agenda is set? In terms of who can get on the agenda and what that process looks like?
No, I don't know, like usually we'll just share ideas about who we think should be presenting, you know, like, and then we'll start scheduling it. Sometimes we're 2 or 3 months out, sometimes we're scheduling 10 days out.
Mm-hmm.
So I don't think there's a, no.
Okay, okay, yeah.
I seem to do a lot of the scheduling, but there's other people that have gotten in.
Great. So one thing that we see that really works is having a transparent process for how the agendas are set, who's on the agenda, how someone can get on the agenda, and then certainly after a meeting, a process for communicating out what happened at that meeting. So what decisions were made, what decisions weren't made, why wasn't a decision made, making sure that everyone is kind of well informed and that there's a known kind of process in place for how information sharing happens. And there's both kind of informal communication and informal communication channels. So informal communications can be really kind of those personal connections at meetings, kind of report outs, whereas formal communications are, you know, some coalitions have an internal newsletter that gets sent out, or some even kind of project management sharing hub where people can report back and provide feedback on documents, social media, websites. So making sure those kind of structures are in place. So that people have the information that they need, particularly if they're not able to attend a meeting, so they don't feel like they've lost out on kind of staying at the table. There's also the role of conveners. So for example, some coalitions have brought out outside consultants for like strategic planning, a neutral party to help do the convening for a meeting, and a process that a coalition's going through, and that can be helpful to bring in if kind of the tension and turf issue starts to get to a point where you need that neutral party. And then the last piece is around conflict resolution. I think we have an example over here, but we have a tool for kind of articulating the process that you take in your collaboration around how you manage conflict. And then actually having that institutional knowledge of noting what type of conflicts have come up, how they've been addressed, what the solutions were, and being able to kind of reflect and share on that so everyone's on the same page. So the last piece here, and then we'll close out. Next slide. Related to communication is around rewarding partners and celebrating successes. This is super, super, super important with this work, so that people feel engaged, involved, motivated, committed, know that they're part of something that's making a difference. So having milestones that you all are working to achieve and acknowledging when those milestones have been met is really important. Having some early successes can help build commitment. So a lot of coalitions have been effective in reducing prescribing and improving their safe prescribing. So taking the time to celebrate that is really important. And making sure that those involved are recognized. So can some folks just share how they've done that? How have they, within their coalition, acknowledged success? What does that look like? And or is that something that you're doing? You guys kind of take time to stop and pause and celebrate at any point?
Well, so I'll say that we did this opioid convening summit. That Nicole was one of the paramount people to put it together. And you know, we did it really, really last minute and really, you know, in a huge rush. And we were just amazed at how many people we were able to recruit to come be like keynote speakers, and you know, and that the feedback from it was we seemed mostly to be pretty positive. And you know, so that's something that, you know, we've bragged about to our directors at public health about what a good job they did on that. And So I think that has one huge success that came out of our collaboration.
People feeling acknowledged for that work. And do you all have milestones that you set in terms of the kind of the tactical work? And it can be actually around the tactical work of MAT access and naloxone, or it can even just be around the infrastructure of your coalition and kind of expanding your partners and those pieces. Do you have milestones around that?
I think one of the biggest ones for us is our morphine milligram equivalents per capita that we made a dashboard and starting to monitor to see if our efforts in academic detailing and safe prescribing are making any difference. And so those have gone down considerably. We would like to take credit. It could be the DOJ or DEA.
But it's happening.
But we see a change that might be because of what we're doing. So.
And you report that out and share that with partners so folks are informed on that. Great. Anyone else?
Well, our coalition kind of came out of a tobacco coalition where they had asked, because it had dwindled so small that we expanded to include, like, go from T to ATOD. And so when we finally restructured and put our guidelines together and stuff, like we officially met at a certain date. When we hit the 1 year mark, we celebrated at our coalition. We also celebrated when we submitted the Drug-Free Communities Grant. And if we get the grant, which we'll know in any second now, because it happened until the end of the month, to let us know. From my understanding, we'll probably have another party. So.
Okay, I think we just have a minute left. Anyone else want to provide an example? Celebrating success? Okay, great. Well, thank you all for joining me today. This was a great discussion. And again, we have some tools and resources if you want to check any of those out. Our website is up here. Make sure that you're on the map. Your coalition is on the map. If it's not on the map, let us know. And sign up for our newsletter. So thank you so much.
Plumas County Public Health Agency, growing healthy communities.